We are talking SPD and all of the things that you can teach patients, show patients as providers. This will also serve patients. So if you're a patient dealing with SPD, pubic symphysis pain, lightning crotch, any of those symptoms, this will also serve you, but we're directing the conversation at providers. It's a way to be a little more concise with the things we talk about in our continuing ed course. It's kind of a quick resource for our top stretches and activation techniques for pubic symphysis based on both research and what we see with patients and how they're getting results. I'm Dr. Jessie.
Dr. Mariah.
And we're just gonna get going. We typically see this condition the most in month 5. It doesn't mean it's exclusive to month 5, but that is when we tend to see it. And then it tends to potentially progress into that 3rd try because you're getting a lot of that shearing force through the disc, and it becomes very, very uncomfortable as the pelvis shifts onto that particular area. And then on top of it, all of this tightens because all of these adductors are attached to the pubic symphysis, to this area. So we're gonna go over everything that really serves lengthening that area without causing more pain and discomfort. We are going to start with the adductor stretch on the ball. And here Dr. Mariah is creating a really wide stance and looking to stretch this stuff in here. And if this doesn't work for a patient, we have another way of getting this area. So here she's gonna push away from the side that she's bracing against. So she's stretching that right side right now for the video for all intents and purposes. But this is the side she's actually stretching through here, the one she's pushing against. And then she would go to the other side. Yeah, and being on the ball also, the stability part of it is wonderful. If this is painful though, don't do it. Especially with SPD, make sure you're telling patients if they're feeling any extra pull, don't do it. So just move on to something else that does work because you don't want to mess with this one and create more inflammation and pain.
Right.
Then we're gonna go into the pelvic tilts, fluid movement through the pelvis. Go ahead, yeah,
Right,
you have thoughts?
Stay still on the ball. Sometimes bringing the knees apart, widening that could potentially increase the pain at the pubic symphysis. As you were talking, I was going to say, or maybe we see this in subsequent pregnancies too, if they haven't experienced it. But anyhow, just looking for fluid movement, right? We all know that movement is medicine. So side to side, front and back, figure eights. That's really the gist of it, though.
Yeah, and it will help. It'll help with low back as well and sciatica pain as well and anything else, but pubic symphysis being one of those. We're going to go right into the ball squeeze, and we're going to go into, well, actually, let's do it with the ball still, and then we'll do it on the ground as well. Again, trying to show you a few different variations for the same type of thing. So she'll still be on the ball here squeezing a Pilates ball. She doesn't have to have a Pilates ball. She can also use her fists if she needs to, but activating those adductors to then also lengthen. So activation and lengthening is going to really serve that pubic symphysis pain. Here she's squeezing. We love the Pilates ball. We typically deflate it. That's just something we've seen in the office. It's nice when it's a little more deflated for all areas, whether you're working low back, upper back, or your adductors like this. But it's nice when you're on the ball because, again, you're working on the proprioception here, and then you're also working on the activation here, which we love, and it feels a little softer, typically.
Yes.
So I like this one if it serves the patient. If it doesn't, we're gonna show you some stuff on the ground. And I'm actually gonna use a wedge. Ideally, you don't want the patients flat, and you can tell them this for home. This is one of our favorite tools, this beautiful knee wedge. It is actually for knees, as it's listed on the internet or anywhere else, but it's nice because it has that flat bed, and then you can put a pillow. She's gonna wanna be careful coming down.
Yes.
And then rolling onto her back.
Good reminders.
Beautiful, beautiful. And then here, she's gonna squeeze just like she did on the ball. But again, if it's too uncomfortable with that imbalance part, now she's here and she has a little more stability, but not flat. Make sure your patients are not flat because they're gonna probably be doing this for more than about a minute, and you don't want them getting dizzy, woozy, or compressing through that vena cava. How's it feel?
Really good, yeah. I was going to say, this is way underrated, right? The activation of our adductors, so underrated. So let's show you some more.
Yeah, we're gonna keep going. Are you able to do the bridge? No, do you wanna do the bridge here? Do you think you can?
I certainly can, yes.
You can do a glute, we'll do it both ways. We're gonna do a glute bridge with compression, with the wedge and without the wedge, so that you can tell your patients that they can do it either way, because it's not as much about how high they get, it's about the activation through the glutes. So here she's gonna do
right, so like nice even stance.
Yeah.
I'm thinking about squeezing the ball and my glutes before I decide to lift.
Beautiful.
That keeps it all off my low back.
How does it feel on the wedge like that?
Good actually.
Good.
Yeah.
Good.
Yeah.
We're gonna compare it.
Often here, yeah.
Well, and that's funny. This is how it works in our office, where we're working on something, we start thinking, oh, maybe we could try it this way, maybe we could try it that way, based on what the patient is saying. So with Dr. Mariah here, we haven't typically done the bridging on the wedge, but here we are trying it, she likes it. So it's something you can do for patients. Just listening to what they need, and then we're going to remove the wedge for her. She'll come down, again, being careful to roll or to come down so she's not just working, or she's not overusing that lower abdomen, potentially increasing that separation. So you just want to be mindful telling patients that. Here she's going to come up while squeezing the Pilates ball. Beautiful. How's it feel?
This does feel more natural to me, right?
Sure.
I mean, this is
Yeah.
where most people likely are.
Yeah.
Especially not having the wedge. But the other thing I was going to mention is I'm 8 months expecting right now. So at 5 months, if maybe, especially if it's their first, there may not be as much weight.
That's a good point.
Area.
Yeah.
So your patients may be more comfortable here doing this. But yeah.
I'm going to steal this. Good. Come on up. Again, rolling to her side. Now she's going to go into the V-sit to get more adductors, because for people like Dr. Mariah, the ball doesn't always stretch enough of those adductors, or say you have a patient who is uncomfortable and in pain, and the ball just doesn't work. You want to give them lots of options to lengthen those adductors, because they are that important. So here she's going to just lean forward with the wedge in front of her so that she can get those adductors. And typically this adds a little more stretch. What do you feel comparatively to the ball?
So again, personally, I get much more adductor here. Yes, there's some hamstring as well, but I like this as well, because I feel a little more stable just being on the ground here. But again, right, just options for your patients depending what they need. Because again, bringing the knees and or feet apart could potentially, possibly
cause some discomfort.
Some more pain. Yes.
Sure. We're going to go right into some adductor abductor work. So here, oh, we didn't do the bear hold. We got to do the bear hold.
Oh,
we're going to do one more activation. So Dr. Mariah is going to use the Pilates ball again.
Still in between the knees, on all fours. And then from here, you may be familiar, but we're just lifting the knees off the ground. And I'm actively squeezing through my knees to hold that Pilates ball there. So this one's a workout.
Which I love. That was beautiful. Again, if patients can't tolerate it, don't make them do it. But if they can, it's great. It's going to be great for that activation. And I would say even for some of those glutes, because of the position you're in, which I love. Okay, so here she's going to do some abductor, adductor work. We love this one because you get a stretch while you do the work. So I'm going to have you hold with this hand onto the ankle. So she is going to just lift 1 inch and back down. Now, some patients this will bother, some it won't. And so you just have to listen to them, but here you're activating adductors, and then you're stretching piriformis, and then she brings her leg out and you're activating your glutes. Now, sometimes with patients, if they're not pregnant, we'll have them actually kind of split their legs so they get a little more glute work. When they're pregnant and they're dealing with SPD, they typically don't tolerate it well. So this is gonna be the one you're gonna wanna do just a straight out and back for the abductors. And then we're gonna show you a standing version.
And on my way there, we're going to talk about decreasing shearing force.
Yes.
That's pubic symphysis. So reminding your patients to avoid getting up in a lunged position, right? So not here, but both feet are on the ground. So maybe it's walking hands and feet together or pushing themselves up into a squat.
That was beautiful. Yeah, avoiding the shearing force is going to be tremendous for eliminating SPD. Yeah, do you want to hop on the wall?
So very same thing, add an AD and abductor.
Yeah.
So because I'm here, easiest for me, of course, just to lift that leg away, right?
So she, if you
Really
can't see it
works.
super well,
I know.
she's like this against the wall, hanging onto the wall for that
Yes.
balance factor. And then for adductor work, she's simply going to bring the leg behind or in front. It doesn't matter, whichever is more comfortable for the patient based on the shearing force. And she's going to move it toward the wall, or actually in this case, she's going to move it out away from the wall. Either way, you want to be
Yes.
moving toward that center so that you're activating the adductors. And that's going to be huge for patients who can't tolerate laying on their side on the ground. Now we're going to go into some box squats, keeping it really centered. Again, avoiding shearing force.
Patient could quite literally use a chair, right, table, or box, but the idea here is that we're no longer doing lunges, and we're getting really good activation of really the whole lower chain. So glutes, right, I'm still getting some activation in the glutes, as well as quads. Right, we are getting some adductor there. So just talk to your patient again on their comfort level, right? I could sit a bit lower, but.
And again, no lunging. She said it.
Yes,
no lunging. You want to tell your patients absolutely no lunging. Even if they're doing a good job activating, you have too much relaxin in your body and your pelvis has already done a ton of shifting. Your center of gravity is off. The muscles are going to work incorrectly. You want to really avoid the shearing force. So here we're just going to show you the belt hook. You know how we feel about it if you've seen any of our videos. You got to wear it super low, especially for SPD Lightning Crotch, because you have to be over the hip, crotch bone, tailbone. She's going to tighten. And again, well, it's mine too, and I'm not pregnant. No, really, it does feel quite good. We don't use pregnancy belts anymore. We use SI belts. We like them because they're in one piece. Women don't have to maneuver a lot of pieces. They're not too cumbersome, so they'll actually wear them. And they're more compressive because you're wearing them low over your pelvis, which is what you actually need to advise patients to do. Last but not least, we're going to talk about the drop piece versus the activator. Based on patients' response, they tend to become a little more tender when we use the activator, which, to be honest, is not what I suspected when we started doing a lot of the repeat care in here with being so niche with pregnancy. I thought the activator would be more tolerable on the pubic symphysis because the pubic symphysis is tender, typically, especially if they're dealing with SPD. It turns out the drop piece is actually a lot more comfortable than the activator. So we pretty much stick to drop and we're assessing here. Now, I'll be honest, when we're doing Webster, we're of course basing it on the soft tissue that we're looking at on the backside, but I'll be honest, I'm thinking we're on the same page here. If there is a side and it's not directly coinciding with Webster and it feels different than what Webster would have told me, I am going to work on that high spot, because that's the sticky spot. So it's not 100% of the time correct or accurate when you're assessing for Webster which side you're gonna do on the front side with the pubic symphysis. I say more with the soft tissue, the psoas, and the round ligament, but not necessarily the pubic symphysis. So definitely get in there and assess. Don't just go in and adjust. I think that's probably one of the more important pieces. So you're just going to assess, you're going to adjust. We all adjust a little differently. We have docs that adjust this direction, and we have docs that adjust this direction and across. It depends on what your body wants. Either way, you just want to make sure you're navigating that direction, that force properly to get that drive where you need it for the pubic symphysis. Yeah. Okay, that's what we got. If you haven't subscribed already to our YouTube channel, whether you're watching it on YouTube or not, go subscribe. Tell us what you want to see. Tell us what works. Enjoy. Love it on your patients.